We all know the little blue pill, a global cultural touchstone for treating male sexual dysfunction. But for years, a major question has remained: is there actually a female equivalent? When we look at this iconic packaging and the blue sildenafil tablets, we're looking at a drug designed to target specific male blood flow mechanics. Female sexual desire involves different biological pathways. The medications designed for women don't target mechanics, they target the brain, treating a specific condition known as hypoactive sexual desire disorder, or HSDD. HSDD is a persistent, sudden loss of sexual mood. It is a recognized physiological medical condition, not a personal failure or a simple lack of sleep. Because of the confusion surrounding this loss of desire, some women may feel tempted to self-medicate or borrow a partner's prescription, hoping for a similar result. Treating HSDD as a distinct biological issue has led to the development of specific, FDA-approved medical interventions designed solely for the female body. There is a strict biological boundary for these treatments. These medications are exclusively designed for premenopausal women. In a clinical context, this refers to women whose natural menstrual periods are still active. For those in this reproductive phase, doctors typically look at two different paths. The first path is an FDA-approved salt known as Agi. Instead of a blue tablet, Agi is this small pink pill marked with F100. The routine for Agi is specific. It is a daily oral tablet that must be taken every evening. Agi doesn't provide an immediate reaction. It works by gradually adjusting the body's chemistry to rebuild sexual desire. As the chart shows, this requires a steady upward curve over a timeline of several months. This makes the treatments a long-term chemical balancing process, rather than a quick, on-demand fix. The second option is Vyleesi. This medication takes a different approach, designed for situational use rather than a daily routine. Vyleesi isn't a pill, it's an injection administered as needed shortly before sexual activity. Because this is a fast-acting treatment, it has a hard monthly limit. Usage is capped at a maximum of 8 times a month. Exceeding that limit causes a hormonal overload. The cap ensures it addresses immediate needs without overwhelming the body's natural chemistry. Having two distinct treatments, one a slow daily build and the other a targeted capped injection, shows that female sexual dysfunction requires personalized medical strategies. This complexity leads to a critical medical warning. Taking male medications or buying unverified pills off market carries significant risks. The chemical salts and the concentrations used in these drugs are not interchangeable. The male and female versions are biologically incompatible. If those incompatible structures clash within the body, the result isn't just a lack of effect, it's a direct interference with internal systems. This interference can severely disrupt the delicate hormonal cycle that regulates the female body. For women in their reproductive years, this disruption can lead to lasting fertility problems. These medications provide a clinical path for a condition once left untreated. Because they interact directly with the hormonal system, they function as medical tools requiring professional oversight, rather than casual alternatives to a partner's prescription.